SCFE sleeve capital femoral epiphysis is characterized by posterior inferior dislocation of femoral capital epiphysis in relation to metaphysis. Incidence is 2 to 10 per 1 lakh population. The incidence is more in male, that is 2:1 male-female ratio. It is more common in adolescence age group. In male, it is between 12 to 15 years age, while in female, it is between 11 to 13 years. In black and white, it is 2:1 ratio. It is more common in summer season. And regarding the risk factors, obesity, endocrinopathy, mechanical factors, trauma and genetic cause are the risk factors associated with SCFE. The goals of management is basically to prevent the prevention of the avascular necrosis, for which we have treated the retinacular flap, restoration of the biomechanics and prevention of further sleep. There are several techniques have been practiced for surgical management of the SCFE, but Dunn proposed a technique for subcapital reorientation and trochanteric osteotomy. Zebra et al. Modified this technique by adding surgical dislocation by Gans et al., which facilitated observation of the vascular flow of the epiphysis. So this modified Dunn osteotomy has advantage of anatomical reduction and prevention of for AVN. The surgical steps which include in modified Dunn osteotomy are: first, the patient is positioned on lateral position. Then we approach through Gibson's approach between gluteus maximus and medius. The trochanteric osteotomy is done. Then vascular retinacular flap is created. Then capsule is opened through inside out technique with jet incision. Surgical dislocation of the femur is done by flexion and external rotation. Femoral epiphysis is checked for vascularity, which we have done. The callus is removed from proximal metaphysis. Then epiphysis is fixed with femoral neck with K-wire or oblique CCS. Capsule and retinacular flap is repaired, and osteotomized trochanter is fixed. My case series consists of 4 patients of SCFE who reported to us during one year time during 2022 to 23. All of the patients were male. We did certain investigation to rule out endocrinopathy. Pre-op evaluations was done with X-ray. Then all patients underwent modified Dunn osteotomy by same pediatric orthopedic surgeon available in our center. Regular follow-up was done at 6 weeks, 12 weeks, 6 months and 12 months. During follow-up, patients were evaluated with X-rays, RECP scores and range of motion. Then post-op physiotherapy was advised as mentioned. The demographic data of the patients: all the patients were between 12 to 15 years age group. All were male. 3 of them have left-sided SCFE and 2 of them have BMI more than 25. We evaluated radiographically with Southwick angle. The Southwick angle in most of them were within moderate severity between 40 to 60. Results: after 1 year follow-up for the 4 cases who underwent modified Dunn osteotomy, we evaluated them by RECP scores, which was above 97. Range of movement was almost within normal limit after 1 year. Post-op evaluation was done comparing with the Southwick's angle, which was within the acceptable limit. Patient's functional status was almost normal comparing to his pre-op status. They were able to squat and sit cross legs. This is the modified Dunn procedure introduced in 2009 aims to achieve the goals by surgically dislocating the hip to expose the femoral head and neck and precise realignment while preserving the blood supply. Our study demonstrated that the Dunn's osteotomy has favorable outcome in terms of AVN and successful restoration of the femoral anatomy in all cases with post-operative sweep angles and adhesive score comparable to previous studies. The modified Dunn procedure by an experienced and using the correct meticulous surgical technique, the results are favorable in regards to significant reduction of the AVN and improvement of functional outcome. Based on our study, we recommend this technique for the management of acute on chronic, moderate to severe SCFE. However, future research with larger sample size and longer follow-up period is required provide further insights on comparative effectiveness against alternative treatment modalities. Thank you.